Welcome to administering Humira, adalimumab, our video demonstration that explains how to inject Humira with the pen or the syringe and highlights valuable information about your Humira injection method. If prescribed Humira, your first injection should be given under the supervision of a healthcare professional. If your doctor determines that it's okay, Humira can be used in the convenience of your home. Make sure you have been instructed by a healthcare professional how to inject Humira before you do it yourself. One of the most common side effects of Humira is injection site reactions, such as redness, rash, swelling, itching, or bruising. These symptoms should go away within a few days. Call your doctor or get medical care right away if you develop any serious symptoms. You can call your doctor or 1-800-4-HUMIRA, 448-6472 if you have any questions about giving yourself an injection. As you know, when you treat with Humira, you have the ability to administer it from the comfort of your home. If you're nervous about giving yourself an injection, watching this entire video may make you feel more comfortable. Plus, it's good to know that you're not alone. Many patients worldwide have experienced injecting Humira subcutaneously. Remember, injecting Humira appropriately is essential to getting the most from your treatment plan. That means, in addition to injecting Humira correctly, it is essential to take Humira on time as scheduled by your doctor. That's because Humira will be most effective if you take it as prescribed. For example, if you stop treatment once you've experienced symptom relief, your symptoms can come back. If you forget to take Humira, inject a dose as soon as you remember. Then take your next dose at your regular scheduled time. Continue to take Humira for as long as your doctor has prescribed it.
You know, initially, I wasn't thrilled, to be honest, about giving myself a shot. And after the first time I did it, I get used to it. I was thrilled that I could self-administer Humira because you could do it at home. I know I need to take it on a certain day, but I could take it that morning. If I know I'm going somewhere, I could take it that evening.
I love the Humira pen. I love it. It's convenient doing it at home, giving yourself the Humira at home.
It's really like second nature, and also with like the auto-injector, I don't have to see the needle. That's a big thing for me.
As you can see, being able to inject Humira yourself can be very convenient, as well as stressful. That's why we'd like to offer you some suggestions about how to inject Humira so that it goes as smoothly as possible. But first, make sure you are familiar with how to inject Humira. You'll want to watch the How to Administer section of this video if you need to review the process. If someone is helping you, have that person watch this video with you so they know exactly what you need to do. Plus, there are some differences between the Humira pen and Humira syringe that you should know about. If you prefer not to see the needle, the Humira pen may make you more comfortable than the syringe. If you prefer to see the Humira liquid as you inject it and have more control over the injection, the syringe may be a better option. So you have to decide what is best for you. You'll want to make sure you are in an environment that is comfortable and well lit enough to see what you are doing. Meditating or simply taking a few deep breaths before the injection can calm you if you're nervous. Remember that the injection itself will be over before you know it. Now, please take a moment longer to watch the following safety information you should know. Thank you for watching our video. If you have questions about Humira, feel free to call us anytime at 1-800-448-6472. Also, please keep watching for just a moment longer for some important safety information and uses you should know about Humira. This information could bring up some questions you may have that you'll want to discuss with your doctor. Remember that this video is not intended to substitute for professional medical care. If at any time you have questions or concerns about your health, you should call your doctor directly. If you need medical attention, you should seek medical care directly. In an emergency, call your doctor or local emergency services for immediate medical attention. Important safety information about Humira, adalimumab. What is the most important information I should know about Humira? you should discuss the potential benefits and risks of Humira with your doctor. Humira is a TNF blocker medicine that can lower the ability of your immune system to fight infections. You should not start taking Humira if you have any kind of infection. Serious infections have happened in patients taking Humira. These infections include tuberculosis, TB, and infections caused by viruses, fungi, or bacteria that have spread throughout the body. Some patients have died from these infections. Your doctor should test you for TB before starting Humira and monitor you closely for signs and symptoms of TB during treatment with Humira. If your doctor feels you are at risk, you may be treated with medicine for TB. Certain types of cancer. There have been cases of unusual cancers in children and teenagers using TNF blocker medicines. For children and adults taking TNF blocker medicines, including Humira, the chance of getting lymphoma or other cancers may increase. Some patients have developed non-melanoma skin cancer. Tell your doctor if you have a bump or open sore that doesn't heal. What should I tell my doctor before starting Humira? Tell your doctor about all of your health conditions, including if you have an infection, are being treated for infection, or have signs of an infection. Get a lot of infections or have infections that keep coming back. Have any open cuts or sores on your body. Have diabetes. Have TB or have been in close contact with someone with TB, or were born in, lived in, or traveled where there is more risk for getting TB. Live or have lived in an area, such as the Ohio and Mississippi River valleys, where there is an increased risk for getting certain kinds of fungal infections, such as histoplasmosis, coccidioidomycosis, or blastomycosis. Have or have had hepatitis B, are scheduled for major surgery. Have numbness or tingling, or have a disease that affects your nervous system, such as multiple sclerosis or Guillain-Barré syndrome. Have heart failure or other heart conditions. Have recently received or are scheduled to receive a vaccine. Patients receiving Humira should not receive live vaccines. Are allergic to rubber or latex or any ingredients of Humira. Are pregnant, planning to become pregnant, or breastfeeding. Also, tell your doctor about all the medicines you take, especially Kineret and Akinra. Some medicines that suppress the immune system may increase your risk of serious infections. What should I watch for after starting Humira? Humira can cause serious side effects, including serious infections. These include TB and infections caused by viruses, fungi, or bacteria. Symptoms related to TB include cough, low-grade fever, weight loss, or loss of body fat and muscle. Allergic reactions. Signs of a serious allergic reaction include skin rash, a swollen face, or trouble breathing. Hepatitis B virus reactivation in patients that carry the virus in their blood. Symptoms include feeling unwell, poor appetite, tiredness, fever, rash, or joint pain. Nervous system problems. Signs and symptoms include numbness or tingling, problems with your vision, weakness in your arms or legs, and dizziness. Blood problems. Symptoms include a fever that does not go away, bruising or bleeding very easily, or looking very pale. New heart failure or worsening of heart failure you already have. Symptoms include shortness of breath or swelling of your ankles or feet, or sudden weight gain. Immune reactions, including a lupus-like syndrome. Symptoms include chest discomfort or pain that does not go away, shortness of breath, joint pain, or rash on your cheeks or arms that gets worse in the sun. Psoriasis, new or worsening. Symptoms include red scaly patches or raised bumps that are filled with pus. Call your doctor or get medical care right away if you develop any of the above symptoms. Common side effects of Humira include injection site reactions, redness, rash, swelling, itching, or bruising, upper respiratory infections, sinus infections, headaches, rash, and nausea. These are not all of the possible side effects with Humira. Tell your doctor if you have any side effect that bothers you or that does not go away. Remember, call your doctor right away if you have an infection or any signs of an infection, including a fever, feeling very tired, a cough, flu-like symptoms, warm, red, or painful skin, open cuts or sores on your body. This is the most important information to know about Humira. For more information, talk to your healthcare provider. Information you should know about Humira. Adalimumab. Humira is a medicine called a tumor necrosis factor, TNF blocker. Humira is taken by injection and is available by prescription only. Humira is used to reduce the signs and symptoms of moderate to severe rheumatoid arthritis, RA, in adults. Humira can be used alone or with methotrexate or with certain other medicines. Humira may prevent further damage to your bones and joints and may help your ability to perform daily activities. Moderate to severe polyarticular juvenile idiopathic arthritis, JIA, in children 4 years of age and older. Humira can be used alone or with methotrexate or with certain other medicines. Psoriatic arthritis, PSA, in adults. Humira can be used alone or with certain other medicines. Humira may prevent further damage to your bones and joints and may help your ability to perform daily activities. Ankylosing spondylitis, AS, in adults. Moderate to severe Crohn's disease, CD, in adults who have not responded well to conventional treatments. Humira is also for these adults who have lost response to or are unable to tolerate infliximab. Treat moderate to severe chronic, lasting a long time, plaque psoriasis, PS, in adults who are under the ongoing care of a physician, have the condition in many areas of their body, and who may benefit from taking injections or pills, systemic therapy, or phototherapy, treatment using ultraviolet light alone or with pills. When considering Humira, your physician will determine if other systemic therapies are medically less appropriate. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. That's 1-800-332-1088. If you cannot afford your medication, contact www.pparx.org or call the toll-free number 1-888-4PPA now. That's 1-888-477-2669 for assistance.